Knock, knock, knock. Hi, I'm Jade. I'm going to be doing a physical assessment on you today. I'll be doing something called palpation, where I'll have to put my hands on you, and percussion, and I'll tap on you. It shouldn't hurt. If you feel any discomfort, let me know, and we will stop. Do you have any questions before we get started? Okay, I'm going to go wash my hands. I'm going to make sure I provide for privacy and close the curtains. I'm going to wash my hands, and I'm going to state that I already took the patient's vitals and height and weight prior to starting. I've noticed when she walked in, she had a nice steady gait, no involuntary movements or swaying. She had good balance, good coordination. Her body is proportionate. When she walked in, I noticed that she has a nice clean appearance. No body odor was noted. She was dressed appropriately for the season. And I also noticed that she was alert and oriented to person, place, time, and situation. Okay, before we get started, I'm going to go ahead and do my cranial nerves first. And I'll do cranial nerve number 1, which is olfactory. I'm going to occlude one of your nares, and I want you to close your eyes and tell me what you're smelling. Okay? First, I'm going to check the patency. Can you breathe in? And breathe in. Okay, good. All right, close your eyes for me. Okay.
Coffee.
Yes, very good. And other sounds.
Peppermint. Good.
Okay, that's olfactory nerve, cranial nerve number 1, olfactory. It is intact. I'm going to move on to cranial nerve number 2, which is optic. We did that prior to coming in with the smell and eye chart. Patient had 20/20 vision in both eyes with no corrective lenses needed. So that one was intact. Next, I'm going to move on to cranial nerves number 3, ocular motor, cranial nerve number 4, trochlear, and number 6, abducens. And I'll do all these together. Okay, we're going to do your cardinal skill to gaze first. I want you to follow my finger with your eyes only. Keep your head still. Okay, good. Cardinal field of gaze are intact. I want you to look at this wall behind me, and when I tell you to, I want you to look at my finger. Okay, now. Okay, good. Eye accommodation is intact. We're going to do visual acuity here too. We're going to go ahead and get that out of the way. So I want you to cover that eye, and I want you to let me know when you see my fingers coming in.
Okay.
Okay. Now the other eye.
Okay.
Okay, good. That is intact. I'm also going to check the pupillary response here. Okay, look straight. Okay, pupils are equal, round, and reactive to light. They constricted from 3 millimeter to 2 millimeter bilaterally. Okay, we're going to move on to cranial nerve number 5, which is trigeminal. Can you bite down for me? And chew. Okay, good. I'm going to touch your face with this Q-tip. I need you to close your eyes and let me know when you feel me touch. Okay, good. That's number 5, trigeminal. It is intact. We've done 6. Moving on to 7, which is facial. Can you smile for me? And frown. Puff out your cheeks. Squint your eyes tight. Okay, good. That's facial. It's intact. We're going to move on to number 8, which is acoustic. I'm going to whisper a 2-syllable word in your ear while I play the other one, and I want you to tell me what I said.
Baseball.
Football.
Football.
Okay, good. That's number 8 is intact. Moving on to number 9 and 10, which is glossopharyngeal and vagus. Can you take a drink of this for me? Okay, good. I would also do the gag reflex here. And can you open your mouth and say ah?
Ah.
Okay, uvula is midline, and that is number 9 and 10. They are intact. I'm going to move on to number 11, which is accessory. Can you shrug your shoulders? Okay, good. Number 11 is intact. The last one is number 12. It is the hypoglossal. Can you stick your tongue out for me? Okay, good. No involuntary movements. I'm going to move on to the head. The head is normal cephalic. It's proportionate to her body. Her hair is thick and soft. It appears to be clean. I'm going to look for any scaling, any nits or inhabitants. Noted or noted. I'm going to palpate for any nodules or masses. And there's a little nodule on the top. Have you had that checked before?
No.
We'll note that. I'm going to move on to her face. I'm looking at her eyebrows, and they are symmetrical and evenly distributed. Her eyelids are no drooping or discoloration. Her eyelashes are dispersed evenly. Okay, can you look up? Down. Okay, her criminal apparatus, there's clear. Her conjunctiva is clear. Her sclera is white. No discharge or drainage, and I'll do that with both eyes. I'm going to go ahead and palpate her sinuses, her frontal sinuses. Do you feel any tenderness?
No.
And look at any tenderness?
No.
Okay, so not any tenderness. I'm going to move on to her ears. And I look at them, and they're symmetrical and even. I note that there's no drainage coming out of the ear. I don't see any lesions. Is that tender?
No.
She denies any tenderness on palpation. Okay, I'm going to get my light. Okay, I make sure I got the largest point available. I'm going to hold it upside down. When I go in, I can see the manubrium and the umbo, all the conal light to the short processes. I can see the tympanic membrane. It's pearly gray. And I would do that to the other ear also. I'm going to move on to your nose. I'm looking at it. It's symmetrical to her face. The nares are even. I'm going to lift up on your nose. Okay. I can see the inferior and middle turbinate. It's pinkish red, no drainage, no deviated septum noted. Okay, I'm going to move on down to her lips. I'm looking at them. They are pink, moist. So there's no cracking or lesions. Can you open up and say, oh, I'm going to put my gloves on before I start. Okay, open up. Stay on. Okay, I can see the hard palette. It's light pinkish pale with rugae. The soft palette is pink. They're both intact. I can see the Stinson's duct on both sides. Her tonsils are a 2+. Get your tongue back up and look under your lip first. Okay, and open it wide. I'm going to grab your tongue. It's going to feel a little weird. Okay, there's no lesions or masses noted. The patient has all of her own teeth. They are white, straight. There are no dental caries noted. I'm going to go ahead and do your carotid artery. Okay, it's a 2+. 2+. Your brachial. 2+. Radial. 2+. Ulnar. 2+. I would do that on both sides. I would do the popliteal. It's about a 1+. The posterior tibial, 2+. Dorsal pedis, 2+. Okay, good. Okay, I'm going to move on to the lungs. I'm looking at the patient. Her chest is symmetrical. And I'm going to listen real fast. While I'm up here, I'm going to do the carotid artery for bruits real fast. Okay. No bruits is noted, and I did that with the veil of my stethoscope. I'm going to listen up here to the bronchial, bronchiovesicular, vesicular, Okay, good. No labored breathing or abnormal breath counts. All lung fields were cleared auscultation. I'm going to percuss on your chest. Okay, good. Resonance is heard throughout. I'm going to go to the back and I'm going to do the same thing. I'll take my stethoscope with me. I'll listen first. Okay. Bronchiovesicular. Okay, good. I'm going to percuss now. Okay, also there is resonance heard throughout. I'm going to check your chest expansion back here. Can you take a deep breath? Okay, good. Chest expansion is equal bilaterally. When I put my hands on you, I want you to say the words 99. Okay.
99. 99. 99. 99.
Okay, tactile firmness is equal. While I'm back here, I'm going to go ahead and check your CVA tenderness. Let me know if you feel any pain.
No.
Okay.
No.
Okay, good. I'm going to do this on the same thing on the front. When I put my hands on you, I want you to say 99.
99. 99. 99.
Okay, good. Tactile firmness is equal. I'm going to go ahead and do your lymph nodes real fast. Pre-auricular, posterior auricular, occipital, submandibular, submental, supraficial, cervical, deep cervical chain. Can you clean up for me? Supraclavicular. Okay, there are no nodules or masses palpated. I'm going to go ahead while I'm up here and have you do range of motion on your neck. Can you lift your neck forward and backward for me? Back and all around. Okay, full range of motion with no crepitus noted. Now lift your arms up to your side and move on in a circular motion. And back. Okay, good. Full range of motion. No crepitus. I'm going to do your elbows. Can you do those two? Up and down. Okay. And your wrist. A little bit of crepitus in the rest. Alright, go ahead and do, I'm going to have you lay back real fast. I'm going to do your, alright, can you bring your knee up to your chest? Okay, good. And one more time, we're going to go out with it. Alright, good. And there's no crepitus noted. I would do that on the other side also. I'm going to do your ankles. Okay, good. No crepitus noted. While I'm here, I'm also looking that there's no edema present on the bottoms. Okay. While you're laid down, I'm going to go ahead and listen to your heart sounds. I'm noticing when I'm looking there are no thrills present or heaves. Aortic, pulmonic, Erb's point, tricuspid, mitral, apex. On here, I'm going to go ahead and do the brachial apical pulses. They're equal. Okay. I'm going to feel for any thrills. They're noted. I would also do sorry about that. Okay, since I'm up here, I would go ahead and I would do the breast, but I would tell you how I would do it. I would have her set up. I would have her put her hands on her hips and push down, and then lift them above her head while I'm looking to make sure everything is symmetrical. There's no rippling or bulging noted. I would start in the armpit, feeling of the lymph nodes. First, the middle lateral lymph node, and I would go down to the cervical lymph node, and I would feel for any nodules. I would start at the bottom and work my way up in a circular motion, going all over the breast, and then when I got to the nipple, I would pinch to make sure there was no discharge or drainage. And then I'm going to move on down to her abdomen. Do you care to lift your shirt up? Okay, I'm looking, and the abdomen is flat. There's no scars or lesions. There are a few striae. When I was looking at her chest, the AC was greater than the transverse. She was not barrel chested. I'm going to listen to your vowel sounds. Alright, the vowel sounds are active in all four quadrants. And while I have this on, I'm going to go ahead and listen to your arteries or bruits. The aortic, the renal, and the femoral. Okay, no bruise is noted. Okay, now I'm going to percuss your stomach. Okay, tympany is heard throughout. Now I'm going to do light palpation. Let me know if you feel any discomfort. Okay, now I'm going to do deep palpation. Any tenderness? No. Okay, good. I'm going to check her liver real fast. Okay, when I push down, I want you to take a deep breath for me. And go. and let out. Okay. Liver is non-palpable. I'll do the same thing on this side for the spleen. The spleen is non-palpable. I'm going to check your kidneys. Okay. Around. Okay, kidneys are also non-palpable. While I'm looking at her, I'm looking at her skin, and it is pink. Vascularity is good. It's warm to the touch. Check your turgor. There's no tinning noted. I don't see any lesions or scars on her arms. There are no visible tattoos. I'm going to check your capillary refill. Okay, less than 3 seconds. I'll go ahead and do it down here too. Okay, less than 3 seconds. Alright, you can sit back up. Okay, I'm going to move on to the reflexes. Okay. Just relax your arm. Okay, good. Okay. Popliteal. Okay. Those were all 2+ so far. Alright, can you put your leg over your other leg for me? Okay. Alright, your Achilles is a 2+. Okay, I'm going to do light and dull reflexes and see if you can tell me which one is dull and which one is sharp. Dull. Sharp. Okay. Dull. Sharp. Dull. Okay, I'm going to do the same thing on your arm. Could you close your eyes? Dull. Sharp. Dull. Okay, other arm. Sharp. Dull. Dull. Okay, and now we're going to do a 2-point discrimination test. I'm going to poke you with these at the same time. Let me know when you only feel one. Okay? 2, 2, 1. Okay, that's about 2 centimeters apart. That's good. I'm going to do the same thing to your lower extremities. Close your eyes. 2, 2, 1. Okay, that's about 1 centimeter apart. When I was doing number 8 acoustic and I did the whisper test, I was also supposed to do the Weber and Ryan test. Alright, I'm going to get this tuning fork. I'm going to put it on your forehead, and I want you to let me know if you can hear it the same with both ears, okay? Yeah. Okay, good. And now when I hit it, I'm going to put it back here on your master wave process. And then I want you to let me know when you can't hear it any longer. Can't hear it. Okay, AC is greater than BC. Okay, I'm going to do the rest of my eye exam. I'm going to turn this to 0 odometers. Odometers. Okay. Okay, I can see the macula. optic disc. It's a yellowish orange color. I can see the vesicles, and the background is clear with no hemorrhage noted. Okay. I'm also now going to check for your red eye reflex. I would dim the lights, but we don't have anybody to turn the lights. So, okay, I'm going to look to them. Okay, and red eye reflex would be present bilaterally. I'm doing those to both eyes. Okay, could you stand up for me? Can you walk heel toe across the room? She has good coordination and balance. And now, with one foot, okay, good. Okay, good balance, no involuntary movements or swaying. Alright, could you stand in front of me and turn around? Okay, can you bend over and touch the floor?
No.
There is no scoliotic deviation. Is there any tenderness?
No.
No tenderness. I do know that there is a medium-sized tattoo on her back. And range of motion. Can you bend to the side? Okay, good. Oh, could you sit back down? I'm going to check your thyroid. Okay, I want you to turn your head slightly to the right and down. Okay, and take a drink. Okay, thyroid is non-palpable, which is good. And your skin turner. I think I'm done. Thank you for being a good patient, and I appreciate it.